Good afternoon. Thank you for joining us today for the third and final webinar, Determining the Best Monetary Value when Using Digital Technology in our webinar series, Effectively Engaging Community in the Ending the HIV Epidemic Process Through Digital Technology. My name is Rouge from NASDAQ, and I am joined by my colleagues Nicole Elenoff, Krupa Mehta, Kendrell L. Taylor, as well as our community partners from the Kaiser Family Foundation's Greater Than AIDS campaign, Robin Kistler and Jeannie Anderson, who will be presenting later on in today's webinar. This webinar is provided in collaboration between NASDAQ and CDC's Division of HIV/AIDS Prevention under Cooperative Agreement PS 19-1906, Component A. NASDAQ would like to thank our project officer, Maria E. Alvarez, CIBA TA lead at the CDC DHAP Prevention Program Branch, for her continued support. This meeting is scheduled to last for 1 hour. If you have joined us via GoToWebinar, you should see an introductory slide on your screen. If you do not see it, please use the chat feature to let us know. Please note that all of your lines will be muted to ensure good sound quality. We will engage in a question and answer period at the end of the webinar, at which time I will unmute all of the lines. If you have questions throughout, please utilize the question drop-down feature located in the toolbar on your screen. This meeting will be recorded and will be made available to you following today's session. Next slide. So in today's webinar, we're going to explore 3 major buckets as our primary objectives. Under the approval of your own project officer, we're going to explore ways that you can explore spending EHE funds on social marketing and digital technology. In addition to that, we're going to segue to a discussion around outcomes around digital technology and some of the primary funding considerations that you may have to consider when you want to take up this work. Finally, we're going to identify how HIV workforce staff can obtain the best value from social media investment. How can we make the best bang for our buck? Next slide. There's many ways that we can kind of look at this. And to start us off, we're going to look at kind of how spending EHE funds can be used. So in our previous webinar, we've discussed a number of avenues to spend EHE funds, of course, with the approval of your project officer. But it's important to highlight that the primary tools that most audiences and jurisdictions will continue to actively engage are the social media platforms, including Facebook, TikTok, YouTube, and so on. They have the capacity to touch millions of folks across all demographics and geographies, and to do so in really targeted ways. We know that boosting content has supported engagement in the past, and as you'll hear more about later today, it's an essential tool in the toolbox to promote messaging when older modes of communication no longer suffice. In addition, as jurisdictions begin to think critically around EHE planning and implementation, there's going to be a vital need for those in charge to integrate digital technology into the work. Community can only be as engaged as much as we attempt to do so, and we know that numerous tools can be used to reach all folks in our planning. This can be done in little and large ways, but it's incumbent on the jurisdiction to evaluate what best fits the needs of the folks on the ground. So this might look like creating websites, subscribing to virtual meeting spaces like Zoom or GoToMeeting, potentially curating online forums using apps and software developers, making hiring plans that involve more IT and technical support so that folks are able to consistently be met, and really integrate all of these tools into meaningful ways so that you can plan, implement, and evaluate your programs for sustainability in the long term. Next slide. In addition to all of this, it's so important to remember that centering the community has to be a persistent and constant theme throughout any EHE planning and implementation process. You always have to ask yourself and your staff, How are you reaching the most vulnerable communities, especially those who might not have access to broadband, might not have access to digital resources, might not have access to transportation to get whatever they may need? So how are we doing this in a way that is promoting health equity and prioritizing multiple avenues to reach the community members? Below are some questions that you can always consider at every stage of the EHE planning, implementation, evaluation process. You can ask, how are vulnerable communities being reached? What are you doing to make sure that they're part of your plan and part of your outreach? How is health equity being prioritized? How are we making sure that those who can be met in a just way are being met appropriately so each time through the process? Are there alternative avenues to reach more community members? We always want to ask if there are ways that we can talk to folks in the jurisdiction, reach the folks in the jurisdiction, and engage them in a methodology that's constantly looking at not just a linear way of going about things, but a more zigzag path and multiple paths. You know, there might be members who could be reached by phone, those who might be older that could be reached online. There's other ways to go about this, and we want to be mindful of that as we move through this process. And finally, who is making these decisions and how can appropriate representation reach more folks? Are there folks who might not be engaged because they don't feel that those who are engaging them represent their values and needs? How are we making sure that folks that are in the jurisdiction are being engaged in a predominantly thoughtful and meaningful way? These are questions to consider, and these are always things that you want to have as you center the community as part of the EHG process. Next slide. I'm going to hand it off now to discuss more about funding considerations and the best bang for your buck to our partners at the Kaiser Family Foundation. And so I'll turn it over to Jeannie now.
Great. Hello. Thank you so much for everyone for joining us for today's presentation. We are very excited to be here with all of you and wanted to give a big special thank you to NASTED for including KFF. It's always wonderful to be a part of these. So to begin with, my name is Jenny Anderson, and I lead digital strategy for the Social Impact Media team at the Kaiser Family Foundation, otherwise known as KFF. And I'm joined by my colleague, Robin Kistler, who leads our partnership work with health departments all over the country. And for those of you who don't know KFF, we are a nonprofit. We are focused on national health issues. We have no affiliation with Kaiser Permanente. And many of you may know of Kaiser's work on our policy analysis side or our polling work, or even Kaiser Health News. And we've spent more than 2 decades producing public health information campaigns focusing on HIV. So we've been doing this work a long time, and including, of course, our Greater Than AIDS and Public Information Initiative. This is our marquee brand that we've been working on for the past 10 years. And today what we're excited about is we're going to share some lessons from all of our work with Greater Than AIDS with you. And we're going to do this focusing on 2 case studies. And we'll do this with, these were partnerships with health departments, one in Louisiana and the other in Delaware. And what this will do is help us lay out some of the considerations we make in planning social marketing efforts when we're engaging communities with EHE information. And what we're always trying to do is get the most impact with whatever resources are available. Next slide, please. So under the Greater Than AIDS brand, we produce and we place targeted media messages across many different platforms. And that includes everything from digital to outdoor, TV, and radio. And what we do is we also work with community partners to support complementary on the ground outreach in addition to these media placements. And so much of what we do is we're doing this in partnership with health departments. And what this approach allows us to do is really stretch limited public dollars in high need areas and then tailor messages to specific needs. And we work with many different health departments with many different budget ranges and campaign durations. And while Greater Than AIDS is national in scope, We focus always on areas and people most affected by HIV. And for us, that means we're often doing a lot of work in the US South, for example, among other heavily impacted areas, including priority EHE counties and states, as well as on disproportionately affected populations. So for us, usually it's, notably Black and Latinx, as well as LGBTQ communities. Next slide, please. So to give you, let's pause for 1 second, if we can. Thank you. We'll look at that shortly, but to give you a quick background about Greater Than AIDS, we focus on all aspects of HIV, and this from delivering the latest on prevention, including PrEP, to promoting routine testing, and to supporting linkage to care and treatment. And as part of all of this work, we also really work to confront the stigma and misinformation that unfortunately we know just still fuel this epidemic. So we really take a 360-degree approach with all of our messaging. And that also aligns exactly with the pillars of the federal EHE plan. So now we're going to give you a little taste of what Greater Than AIDS looks like in action. So we have a very short video for you that we produced last year to mark the 10th anniversary of Greater Than AIDS, which we celebrated last year. I think we can't hear the sound, but that's okay.
Hi everyone, this is Robin Kistler. I hope you enjoyed that video. It does have a really upbeat soundtrack to it, so I hope you in your mind you were channeling your favorite beat along with. And for those who may just be coming out of lunch, that you're lively and awake at this point for this presentation. So as Jenny mentioned, I coordinate our health department partnerships with Greater Than AIDS, and I am really glad to be joining you all today. In the midst of everything else going on, we really appreciate you choosing to spend this hour with us. Whether you're new to Greater Than AIDS or have been family with us for a long time, we welcome your partnership. And whether you're at a health department, a CBO, you're individual affected by HIV, we are all family together. And as you saw in the video, it's all about us coming together and unifying resources to make the most. A big reason we've invested in media-based efforts is because media is a key means of getting information out and educating communities. Even this many years into the HIV epidemic, there continue to be so many information needs. We've been getting the word out about PrEP now since 2012, and before that with the trials. We've been reminding people how important testing is, providing updated science around viral suppression and HIV undetectable. And of course, the biggest challenge we all face, as Jenny mentioned, stigma. Our approach is 360, and given the disproportionate impact of HIV on specific communities, often we're talking about very focused demographics, a few zip codes, minority populations, whether it's race and ethnicity or sexual orientation or gender identities, or all of those intersections. And usually we don't have very big budgets to work with. We're public health and we save lives with what we've got. So there's some good news when it comes to digital technology and supposedly, quote unquote, hard to reach populations. I hope you hear my air quotes since you can't see me. We actually have some great ways to reach our priority audiences. And with digital technology, we can focus pretty limited resources very specifically where they can make the most impact. So this brings us to the core of today's discussion. If we can jump to the next slide. We're going to spend quite a bit of time talking through these key planning questions today. You can take notes. This is some substance and meat, and then we're going to illustrate them with some case studies. So our intention is to help you get the most out of the resources that you have available. And today, to help maybe think through some opportunities of how you might use digital technologies differently, media in particular, to support your community engagement efforts and increase health equity. As with most aspects of HIV work, a little planning can go a long way. I'm definitely known for being a winging it person, and Jenny's a great planner, so together we're a good team, and definitely when it comes to implementing media, you have to have a well thought through plan. Otherwise, you really can waste a lot of money. So this list of questions is intended to help you leave this session with enough familiarity with media planning to know what questions to ask up front when it comes to using digital media to engage your community. I've heard a ton of pitches from a lot of sales folks for various media platforms, and of course they are all really convincing that their approach is the best thing since sliced bread. But the proof is in the pudding. Your job is to get a good deal, to shepherd the public resources entrusted to you, to move the needle on issues related to HIV we all care so much about. If you go in knowing what you want, you'll come out with a better media deal. So we're going to spend a bit of time and talk through some examples. First and foremost, who are we trying to reach? This first question I'm just going to underscore a ton of times, because when we start a new question, we need to know who the audience is. So come to that conversation, come to that initial conversation knowing who you want to reach, and then ultimately why. This can seem easy. I'll often hear, we want to reach everyone in the community. We want everyone to know about all of these things. But when you get into it, it takes some internal discussions to prioritize. Unless you have a giant corporate marketing budget that's like enough to really reach everyone a bunch of times on a lot of platforms, we really do need to prioritize. And if we focus, our campaigns can land where they can make the biggest impact. The more we can refine this audience statement, the clearer our plans can be. You've probably already defined your priority populations as part of your EHE or other HIV work. I'm guessing Black and Latino MSM are at top of the list, but maybe you're focused on Black women and PrEP or stigma and faith communities. I know you're having these discussions as part of your community engagement efforts, so let those guide you. For the barriers you've identified, who needs to be reached? Look at your epi data for gender, age, race, ethnicity. Look at the geography. Can you reach most of your epidemic in a few zip codes, or are they spread evenly across your area? Who should be the top priorities? And now, how big is this audience? Are we talking about 700,000 Black women in the state of South Carolina? Or 28,000 MSM of color in San Antonio? Or both? That scale matters, and everything else flows from the who in your equation. So we put them first and encourage you to take some time to make that clear. Next, what action do we want them to take? Almost every ad should have a call to action. Find out about PrEP. Ask to be tested. Visit our website. Did you just add a PrEP clinic in a key area? And maybe the best thing you could do is direct clients to them to build their success. Keep this clear and specific. If you're trying to say, find out about PrEP and ask to be tested and visit the website, it's just too muddy to put everything together at once. And the result is your audience won't remember anything. You've missed the opportunity to move the dial on at least one issue. So discern what is that one clear action you want your audience to take. And this ties very closely to the next issue, your referral resources. What is available? Is it a phone number? Is it a website? Where can your audience get more information? And here's a little tip. If it's a website and what you're measuring is traffic to that website, you're almost always better off with a digital platform. It's just so much harder to go from seeing a billboard or hearing a radio ad to typing in a URL versus just clicking your thumb on an ad that's already in your hand. Okay, budget, timeline. In reality, our programs don't have unlimited resources. We need to start with a sense of scale. So what do we have to work with? If it's $2,000, there's maybe no way to reach the whole jurisdiction with a message. Maybe we need to think again about how ambitious our audience size is. Doesn't mean you can't do something meaningful with $2,000. We're going to show you some examples. But if we keep South Carolina as an example, maybe those 700,000 Black women in the state are really a subset of that group who are living with HIV. Now I've got a much, much smaller group, maybe 1 or 2% of the women to reach, and my budget is an okay fit. This is just a reality check. Is your appetite bigger than your wallet? Maybe you can adjust expectations to work within what's available, or ideally scope out what you could do with more resources and go ask for them. Like, listen, I've got a strategy. I can reach 700,000 women in the state. Can we invest 10 cents a person and spend $70,000 on a prep campaign, for example? We have a lot of tricks for helping to figure out a good budget level. You can kind of think about a formula, like the size of your audience times the number of different messages, like sort of calls to action you want to deliver, times the number of platforms you want to be on, times the number of months you want to run the campaign. I did that pretty quickly, but the numbers can get pretty big. So most often, the reality is we don't have as many resources as we ideally would. We have a set amount to allocate. And so, as I promised Rushab, I would say, this is about getting the biggest bang for your buck. Where are you going to put your dollars? So now, what media options are the best fit, and how will we measure success? This is such a huge topic, and we've done other webinars to talk through what an ad looks like on Facebook, what an ad looks like in different platforms on YouTube, what your possibilities are. So if you missed the last one, please go back and rewatch or refresh your memory. And today we just want you to recognize that all of these pieces need to fit together to match your budget, your action, and the media you choose. TV's off the table if you don't have broadcast quality videos that are exactly 30 seconds. Actually, we could probably help you with TV ads. You can certainly call us, since we have a library of available messages that are free for public health agencies. So, sort of think about what are the all-encompassing costs that make a particular media platform a good fit. Similarly, for billboards or transit, you need high-quality design that can be printed to a large scale. Those are both great formats for reaching a lot of people, and there's some ability to focus your message, like through what TV shows the ads are on or where you put the billboard, but generally those are broad reach general audience formats, and they can be a bit pricey. If you're bare bones and you don't have money for videos or designs, radio can be a really great option. Most stations will produce a script for you for free. You can decide what you want to say and they'll record it. But again, most radio stations have broad audiences with limited demographic options. The signal may reach the whole city, but probably not the whole state. If radio's in the mix and a match for our audience, we want to be strategic about choosing stations that have the right audiences at a reasonable price. You'll see in the example Jenny will present for Baton Rouge that we actually found really good coverage on the top radio stations there for an amazing price. And that helped us increase the number of times we were reaching our audiences, and we were able to tailor the scripts to the campaign goals there. So that brings us to the meat of today: digital. Facebook, Instagram, YouTube, MSM dating apps, Google Ads, those search terms when you're looking for information. There's a million others. And what's amazing about digital is that you can focus your money. You may not be able to reach the whole state with $1,000, but you might be able to reach all the guys on Jacked in your area. As Americans have shifted their media consumption more and more to digital spaces, we have more opportunities to choose our audiences quite specifically by zip codes, gender, and other attributes. I'll hand the baton back to Jenny to kick us off with an example that combines a mix of these strategies, digital and traditional options, leveraging the strengths of each.
Great. Thank you so much, Robin. Next slide, please. So now what we want to do is we really want to get into the examples to illustrate how we thought through all those key questions that Robin just walked you through. So we have two projects. They had very different goals and very different levels of resource. So we think they'll be, helpful to illustrate kind of a range of examples. And the first one we're going to look at is from East Baton Rouge Parish. And this was a partnership we implemented with the Louisiana Department of Health last fall. And some of you may know that Baton Rouge was selected as one of the 3 pilot areas last year to kick off the EHE national strategy. And we've actually been working with the state of Louisiana since the beginning of Greater Than AIDS on various social marketing efforts, including a 3-year initiative in New Orleans that focused on PrEP, and that had wrapped up last summer. So it was, a natural extension of our partnership to develop a strategy for messaging in East Baton Rouge on really short notice last summer when the state was offered some additional resources. Next slide, please. So remember that first key question Robin just talked about? Who is the audience, right? So this is where we always start our efforts when it comes to social marketing. So the first thing we did with Louisiana was to look at the demographics of the area. So what we found from reviewing the epi data was that 95% of people living with HIV in the parish resided in just 15 zip codes. We also found that residents in these zip codes represent 80% of the population of the whole parish, and a little more than half are Black. In addition, when we looked at HIV in the area, the vast majority of people living with HIV in the area, over 86% are Black. So given this data, we looked at these, we agreed with the health department that while some messages would reach the entire parish, the priority focus would be on Black residents in those 15 zip codes. Next slide, please. So now to that next key question. What do we want people to do? What is the goal of this, the call to action? Why do we want people to engage in our messages? So the priority for the state, in this case, were to increase knowledge about PrEP as well as HIV and detectable. And in terms of that action step, what did we want people to do? The state wanted to get people over to their website. So they set up a website. We created a vanity URL, endinghivbatonrouge.org, which would connect people to local resources in the area. So we pretty quickly, we mentioned this is a pretty quick turnaround. We created a 2.5-month multimedia strategy, and it started last October. And you can see here on the left how we allocated the available budget. And just to note, this is a pretty good size budget. We had about $255,000 to place, and this is for an area with a population of about 440,000 residents. So you can see here we spent almost half, about 45% of our budget on digital. And it was a pretty extensive campaign with a focus on YouTube and Facebook and Google Ads. And as Robin mentioned, the reason we focus so much on digital is because it allows us the most ability to really target very specific audiences and interests. It allows us to track and engage and also really push people over to another resource, a website. We know, again, if you're seeing a digital ad, you're much more likely to click and get connected to a website versus seeing a URL on a billboard. So on digital, we served messages to the whole area, and we had a special focus on those 15 zip codes with the highest HIV prevalence. And then we also supplemented digital with billboards as well as transit, radio, and TV ads. We also had designed posters, and we shared all the videos and all the digital media messages with local partners, which they used in their clinics and in their community outreach. And in part, we were able to do so much and be on so many platforms because we already had those messages, the videos and graphics that we could quickly localize with the health department's logo and website. So that gave us a lot of options. And as Robin mentioned, one of the benefits of working with us is we have this amazing library that's covers many different HIV topic areas and is available for folks to use. So the campaign was designed here to create unity and community around addressing the epidemic, and also to support all the on-the-ground activities that were also part of the local EHE plans. So some takeaways for us about this strategy are that it was a focused push, again, in a very short amount of time, about 2.5 months. And with that level of budget, we could layer messages to reach the priority areas multiple times on multiple formats. For example, you might see a video on your phone and then walk by a bus poster. You might hear a message about PrEP on the radio and then another one the same day about HIV undetectable. And when it comes to radio, we can't control how far the radio stations broadcast. We know those messages reach our 15 zip codes as well as far beyond that. But what we did do is we chose stations that are most popular with Black residents. And similarly, the buses go all over town, so we know that they're seen by everyone, but they also have routes through those zip codes. And so we chose transit shelters and billboard placements in prominent locations within those zip codes. And then everything else, digital ads, cable TV, we focused on the priority communities. Click, please. Excellent, thank you. So here you can see, so what did this all lead to? We had a lot of placements happening, and the placements generated nearly 32 million impressions. So let's pause for a moment on that term, impressions. Some people might be familiar with it, it might be new to others. So just to be on the same page, a media impression refers to the number of times an ad was shown. So again, a media impression refers to the number of times an ad was shown. And they aren't all equal. So we know driving by a billboard isn't the same as a full 30-second video ad. but essentially the common denominator across all media formats are called impressions. So what does that mean here? What we can estimate roughly from this total of about 32 million impressions is that the population on average, which was again about 440,000 residents, if we reached all of them, they would have seen the campaign about 72 times over the 2.5-month period. Another way to look at it is that's roughly once a day. And of course, we know some residents would have seen it more, some less, but it gives you a scale to know that this was a very visible campaign, especially understanding that more of those impressions were concentrated in the areas most affected by HIV. And what was exciting about this project is not only did we place the campaign, but we were able to conduct a survey after the campaign to show that it was, in fact, a highly visible campaign. Next slide, please. So after the campaign had been up for about 2.5 months, KFF conducted a non-probability online survey, and we did this with a research partner. And we recruited folks through Facebook ads, and we limited our recruitment to IP addresses in those 15 highest priority zip codes. And respondents were also asked to enter and confirm their zip code in those priority areas once they got to the online survey. And only those in our areas were eligible to continue with the survey. And our goal was we aimed to match the area's demographics as closely as we could. And as you can see here, we ultimately had 434 respondents, a little less than 50% male, about 56% Black. Next slide. Thank you. So what did we learn from this survey about our campaign? Well, it was pretty exciting. We learned the campaign had high visibility, as we had expected, with the large majority recalling seeing the campaign. We also saw this was especially high among Black respondents. And as we noted earlier, the 15 focus zip codes with the highest rates of HIV were predominantly Black. So we were glad to see this. Next slide, please. And most importantly, not only did people see the campaign, but they found it, they liked it, it was relatable, it was useful. And again, we saw these results were most favorable among Black respondents. Next slide, please. And on the left, you can see here that those who were familiar with the campaign were more likely to answer yes to the question, as far as you know, is there a prescription medication pill, a prescription medication PrEP that people who are HIV negative can take to lower their risk of getting HIV. And on the right, those familiar with the campaign were likely to have confidence that PrEP is effective. Again, all indicators that the campaign was achieving what we set out to do, which was really exciting to see. Because there we saw those who saw the campaign were not only more likely to know about PrEP, but they had confidence in it. So that was really exciting. Next slide, please. We also saw that those who saw the campaign were more likely to have heard of HIV undetectable and to know what it means. Again, moving the needle on that other goal of not only informing people about PrEP, but about HIV undetectable as well. Next slide, please. And of course, we know that believing that ARVs, antiretroviral medications, work to reduce transmission is so fundamental, both for encouraging people living with HIV to get into and stay in care, as well as for the rest of the community to understand it's possible to thrive with HIV, and treatment can be incredibly powerful. This also helps reduce stigma. So this is a really important, another indicator that we saw that we were able to shift the needle, move the needle in terms of people's understanding of what TASP is and the benefits, both for those living with HIV as well as those at risk. So now I'll pause there. I will note there was a lot of data and we moved quickly through this. We will be answering questions at the end as well as sharing the slides. So look forward to any follow-up questions later on in the presentation. In the meantime, I'm going to pass it back to Robin briefly to walk you through a very different case study in a different part of the country with a very different budget and media mix. So back to you, Robin.
Thank you so much, Jenny. That was great. I think we could go to the next slide. And if you are sitting there thinking, there's no way we're going to have $250,000 to spend, and you know, this is like the Cadillac version of all of these different media platforms, that we need something more digestible in our community, I've got an example for you that sort of again, that sort of right media, right fit for right opportunity, and a different way to show how digital media can make a difference. But you know, in an ideal situation, Baton Rouge was ideal for a lot of reasons. It was focused. There were two very clear, you know, pieces of information to communicate, building understanding of PrEP and undetectable. It was very measurable, and that's part of why we were able to do the survey and be able to show the increased knowledge there. So let's shift our geography and take a little road trip. We're gonna go east from Louisiana. We've got a long drive all the way up to Delaware. Still in the South though, just in case you didn't know that about Delaware, that's something I learned in this job, is that we are still in the South in Delaware. And we're shifting themes here too. So the focus of this case study is the EHE pillar about diagnosing, and more specifically diagnosing HIV in the time of COVID using HIV self-tests. Our partner here is the Delaware Division of Public Health, and they let us know this spring that HIV testing had decreased by 75% in the first quarter of this year based on their partner reports. I know that's happened in most places across the country, just huge drop-offs in testing. And the CDC had just issued their Dear Colleague letter encouraging self-testing as a tool to help close some of the gaps during this time. So this division quickly made a decision in the spring to order 1,000 HIV self-tests and see if they could set up a program. We had actually just coincidentally just put a contract in place to help them with social marketing, and so partnered to direct some of the resources to support the pilot program. Next slide, please, Nicole. So as I mentioned, this was on a very different scale than Baton Rouge. We had about $6,000, and we're really just demonstrating what might be possible. Could we get residents to request tests? And this was the first foray for Delaware into social marketing around HIV with us, and kind of generally, they hadn't done a lot of promotions, and certainly not digitally. They'd historically been on cable TV, and so this was like a look what we can do. And given the size of the budget and the value of each of those test kits, right, they had already invested a lot in the test kits, we wanted to make sure that they went to communities and individuals where diagnoses were most likely. Like the EHE pillar isn't to do as many tests as possible, it's to diagnose, right? So we wanted to be strategic with the resources we had and put them into digital placements, put our ad dollars into digital placements where we could focus our audiences quite specifically. So that led us to allocate 90% to Facebook and 10% to Grindr. I'll talk a little bit more about the audiences on Facebook in a moment. These ran for just 3 weeks. In late June and early July, we scheduled them around National HIV Testing Day. And in terms of metrics, they delivered over 900,000 impressions. Again, that's that word we want you to leave here familiar with. It's the number of times that the ads were shown to audiences. And they reached cumulatively over 116,000 people. In other words, if you do the math on that, try to keep the math kind of light on this, but there is some arithmetic in media, you know, bang for your buck. Some folks saw this ad multiple times. And in marketing, we need that repetition to drive action. Think of the ads you see in the media you most consume. I know for me, the first couple of times, I just don't even pay attention. It's a little bottom, you know, banner at the bottom of my phone. But then the 5th or 6th time, you're like, oh, maybe this is something you might take more notice and check it out a bit more. So it's another way to look at your campaign, the frequency of messages for the priority audience. And when you're dividing a budget into, you know, among a bunch of different people, it's another place that it can be helpful to focus your dollars so that you're getting enough frequency to move the dial again. So next slide, please. In this campaign, the action that we wanted was again to get to a website. But in particular, we wanted folks to get to the website because in order to get a test kit, they needed to contact one of 6 agencies that had the self-testing kits. They're in different areas of the state, and our ads were running statewide. So once a client's reached out, the agency would do some basic screening, collect contact information, and either mail them or arrange for contactless pickup. So we needed a web page to refer them to in the digital ads, which is a fundamental component you really need to think about for digital advertising. There's always a click through. So you need to have some place for them to go where the audience gets the information. That's exactly what you're advertising, that, you know, it all matches up and they have a good user experience. So we started with our Delaware localized page. This is something that we do for all of our partners. Jenny's team leads this, and we added that get a free HIV test, you know, major promotion that's hard to miss right in the middle of it. And if you jump to the next page, We can show you what the ads look like on digital. So far more, I mean, like 90%, the vast majority of our sessions come from mobile devices. So we always design for mobile first. So that's something else to be thinking about as you're designing your campaign and the resources you're connecting people to. It needs to scroll nicely on a mobile phone and size nicely. So imagine this as sort of scrolling down. The first screen is what is a home kit, right? Somebody's just what? You can take a test at home. How's that work? Describing it, the little cartoons showing it, clear, simple, easy information. And then the center piece says find an agency near you on that little drop down bar. That's how we're going to get to the agencies. And then it continues on with how does this program work? What can I expect? And below that is what if it comes up positive and what if I'm negative about PrEP and condoms and other options. So if you wouldn't mind clicking one more time, we can take a look at what happens if we picked an agency. So when you go into that drop down, you get a list of the 6 agencies that had the kit. So we need people to get in touch with these folks in order to get their kit. Sorry, that circle's showing up a little off, but fundamentally they needed a call or email. The HIV Consortium had an online form. You put in your request, give them your contact information, and they'll get you a kit. What's great about this model is that then we're doing HIV testing, still with some screening, right? Still some support, and especially if it does come up with a preliminary positive, you're connected to an agency, you know exactly where to go for follow-up services. On the side note, something that was interesting about this project, since it was such a manageable number of partners, we were in touch with them every week. You know, how many tests are you giving out? Are you getting emails, sort of troubleshooting, anything coming up? And all of them saw far more requests by email or their digital forms than phone calls. So just kind of a takeaway, right? Understanding our audiences and what we can learn by looking at our digital data. Folks would really rather have that almost, it's not quite anonymous, but it's a little more confidential maybe than talking on the phone. And it works, you know, any time of day. Our audiences are not seeing ads from 9 to 5, right? So we want to be available to them, and those access points were really critical for that. Okay, so now I've lost my place. Let me get back in. Okay, let's jump ahead and we'll show you what our Facebook ads look like and talk a little bit more about how we focused that strategy. So you may know from our previous webinar or your own work, or if you've missed all of those, Facebook gives options for choosing your audience that include geography, down to a zip code level, gender, language preference, and user interests. In Delaware, we use these options to serve 3 different audiences. We spent about half the budget on men with LGBTQ interests. That's sort of proxy for MSM. Interests like pride, gay bars, LGBTQ publications. So we're really able to focus the ads on the communities that are most likely to have positive diagnoses. And then the rest, we were serving ads to high prevalent zip codes, predominantly Black and Latinx. And then we also had an allocation for Spanish speakers because people are consuming media in 1 or more languages. That's an easy thing for the media companies to detect, and a really great way to focus on communities that are sometimes underserved, particularly Spanish speaking, monolingual and bilingual folks. And that was a priority for the health department. So we didn't have enough funds, obviously, to saturate the entire state and those larger audiences of all of the zip codes, but we were able to show that it works. And agencies were so delighted with the results that they asked the health department to expand what we're doing, and they could see from the clients asking for tests exactly when we shifted from our MSM focus to the zip code focus. So again, you can just like in real time track what's going on between digital and real life. Okay, we have just a couple more slides. I think I have one more here about our Grindr ads that we ran for the campaign. Super clear and straightforward. If you click the slide again, actually, I think the one on the right might animate. It may work out to be a cute little video situation. Thank you, Nicole. You're doing an amazing job with us. So Grindr is a great option for a number of reasons. They have a do-it-yourself platform where you can choose your audience, upload your banner, and watch your campaign roll out in real time. And of course, it's focused almost exclusively on MSM. They sell ads based on impressions, which is the number of times that ads shown to users. You all know that now because you're like graduates of this course. The smallest size, that one down there at the bottom, the easiest to ignore, but it's also the cheapest to buy. And this was the best bang for our buck. I think I've said that now 3 times, which was my whole goal for this presentation. So you have to spend at least $100, but they sell those little banners for $2.50 for 1,000 impressions. I don't know like where you can get 1,000 copies of a flyer for $2.50, right? Like that is a good deal. And it can go a long way because we're offering a free test to take it home. What a great fit for this audience in this time and for this health department. So I think we spent about $600 on Grindr and we had 1,000 clicks to the site from that. Just great value. I love this project because it's so tangible. Place the ads, get test requests. And the partner agencies were super great. They made their personal emails and mobile numbers available and gave great customer service. And they also said the ad campaign built a level of awareness by word of mouth. So even after the ads had ended, they were continuing to get requests. So we just did another round for them last week. It continues on. This was another great success story. And just the takeaway of that digital technology can help you put your resources to work, focus on priority audiences in a way that builds health equity and reaches community effectively, even during these times when outreach is more restricted. Baton, back to you, Jenny, to close out.
Great. Thank you so much, Robin. Next slide, please. So those HIV self-test messages that Robin just showed you during this Delaware case study, they're part actually of a larger COVID-19 campaign we've put together, the Stay Connected, Stay Healthy campaign from Greater Than AIDS. And the goal of this campaign is really to reinforce the importance of keeping up with HIV prevention, testing, and treatment during COVID-19. So in addition to the specific resources you just saw that were used in Delaware, if you go to the next slide, please. We wanted to walk you through this digital toolkit. So this is a screenshot of a digital toolkit we have on the greaterthan.org website. It's our Stay Connected, Stay Healthy digital resource hub, and it's available for everyone to use. It includes downloadable graphics on topics such as teleprep, HIV self-testing, as we just saw, HIV and COVID, and other topics. And a lot of the messages are just saying, you know, some of these services may look different, but they're still available. So we very much encourage you to check it out, take advantage of all these awesome free resources, download them, use them in your work, direct people to your services. So just wanted to make a little plug for that, for folks to know that these are accessible for everyone. And they have both static images as well as some animated graphics as well. All right, next slide, please. So we just also wanted to remind all of you, you know, we covered a lot today. We know there's a lot to think about when it comes to social marketing. We talked about trying to figure out who your key audience is, what action you want them to take, where you're going to refer people, what budget is available, what is the best media options, the media mix. But we also want you to know you don't have to become an expert in all of this. This is something Robin and I do every day, all day. We would be eager to partner with you in your jurisdiction to help you strategize and consider some different options to get the most bang for your bucks. So just wanted to make sure you had our contact information here. Please don't hesitate to reach out. We would love to talk with you. And next slide, please. And our goal was to leave 10 minutes for Q&A, and I think we are doing that exactly. So we're really excited to pause here. We know we've covered a lot and would love to open this up for questions and discussions.
Thank you so much, Jenny and Robin. This was an incredible presentation, and I think you really helped demonstrate great ways to get the best bang for your buck. And currently, it doesn't seem like we have any questions in the chat. But yeah, any questions, please go ahead and post them in the chat or in the question and answer bar. I also see that there's some folks that have raised their hands. I'm gonna try unmuting you to see if you'd like to ask your question. Monica Gutierrez. I think you are able to unmute. Okay. If not, please go ahead and put your questions in the chat. So here's a question. Robin and Jenny, now that we've had all three of these presentations, what do you think would be the best next steps for jurisdictions in crafting social media campaigns for community engagement?
I'll take a stab at that one, Nicole. I think at some point you just have to start giving it a try, particularly if these platforms are newer for you. Maybe you like negotiated really hard to be able to have your own Facebook account, right? Maybe separate from the health department, and it's specific to HIV, STD, or the Ending the Epidemic initiative. You know, building up an audience and figuring out a schedule of getting posts on is a lot of work. And you can put a lot of effort into making posts to 20 people who are following a new account, which is tricky. But if you add some dollars to that mix and you're able to boost those posts or do some promoted ads, you can put your resources then into getting in front of the eyeballs of folks and giving it a try. So I think just get started with something as we talk through those key questions. Pick an audience, pick a topic. What are you trying to get them to do? What fits your budget? What's the right platform? And if you want any advice or just like run a plan by us for our input, as Jenny said, we're totally available, and we love sharing what we've learned by doing this, nationally and in specific areas to help you build up your own program. Like ideally you're doing all this yourselves, and then collectively we're getting more information out about HIV. So I would pick a platform, pick something that's new to you, and that really strongly aligns with the rest of your priorities, so that media is not something off on the side, but it's like an integral part of your linkage to care program, or an effort to reduce stigma. There's very few things that can change the stigma around HIV in the way that media can. It really can help to shape attitudes and maybe shift a little bit the way people think about HIV. So get started, and then more platforms like this to share experiences and learnings and how it goes for everyone, and what you ran into that you weren't expecting, sort of barriers and how you overcame them, I think could be super constructive.
Thanks, Robin. We've had a couple more questions come up. One of them is, should HIV programs consider hiring staff to manage the social media for their community engagement, or would it be better to have one-time campaigns?
Can we make an and option along with the or? So I would say the strongest social media efforts that I've seen work well when you have both in place. So there's regular posting, you're building your own audience, whether it's off the health department's accounts or sort of your own that are specific to these topics. So there's kind of organic posting, you're building trust. It doesn't cost to make those posts. Obviously, there's an investment in the time, which is sort of, I think, at the root of the question, right? Like, should I hire somebody for X amount of dollars for a year, or put that money into campaigns? I think the fast and easy is to have a campaign and you'll get in front of people. But build your own accounts and following and sort of leverage them that way is an investment. It takes time. But I think long term, social media is here to stay, and it takes a lot of time to coordinate and to do it well. And if you're not going to do it well, I don't think there's a whole lot of use in doing it, because then we lose the trust of our audiences. And I think it's important to invest in doing it well. So I would love an and option. But if it's an either or, you're sitting with a certain line item, you've got $30,000, what should I do with it? I would go back to those questions. What's your priority right now? What are you trying to do? Is there a campaign that in, a month or a couple of months could really shift things in the direction that you're trying to move them? Or are you trying to build some long-term infrastructure that can help make social media an ongoing part of your response?
Thanks, Robin. I'm going to ask one additional question, and then the questions that we were not able to get to at this moment, we will make sure that our speakers get to answer them, and we will include them in the slides and materials after this and send them out to everyone. So this last question is, in the first case example, you had some really great survey data. How did the logistics of that survey work?
Jenny, do you want to chime in on that one?
Yeah, absolutely. So in terms of the logistics, so we placed ads on Facebook for the recruitment. Then folks who clicked on the ad were connected to an online survey. In the survey itself, we embedded some visuals, we had videos and opportunities for people to see some of the campaign creative. And then on the back end, we collected and analyzed all the data with a research partner. We did also provide incentives for people to participate in the survey. We found that without an incentive, it was much harder to recruit folks and entice them to be a part of this important research. So I think that addresses it. Robin, was there anything to add to that?
No, I think that's great, and we're happy to talk you through more specifics of methodology. I think one of the luxuries we have is sitting at KFF that has such a well-renowned polling team, and we're able to tap into some of their expertise, as well as our, it's decades that we've been running media campaigns, and most times we don't have the opportunity to do the survey. It's cost, it's time, it's, can you really attribute it to the media? There are a lot of factors, but we do have a lot of experience in designing the questionnaires and the methodology so that the surveys can be as meaningful as possible. So, an example is if I have somebody, did you see a Greater Than AIDS ad? Maybe they know what Greater Than AIDS, the logo is, but it's a different question to ask. Have you seen a billboard that looks like this, talking about a pill to prevent HIV? Sort of much more descriptive, and ideally actually showing, have you seen this? Showing it to them, the visuals, or there were some videos in there too. Does this look familiar to you? So we've learned a lot from trial and error and from leveraging the expertise of our colleagues, and would be happy to share those specifics with anybody who's interested.
Yeah, and I would just add, I don't know if I was clear in my description, but the survey itself was not part of Facebook. Facebook was the recruitment tool, but people actually completed their responses using a different web platform, and that platform allowed us to make sure that folks from the same IP address weren't completing the survey more than once. And so we had that added benefit of using a really robust research tool to collect and then export the data from as well.
Thank you so much. And again, we will include the additional questions that we weren't able to get to in the supplemental slides that are sent out. NASDAD also wanted to share our new Ending the Epidemics Hub. This website is a one-stop shop where you can get up-to-date information about the webinars we just did, new upcoming webinars. It provides a high-level overview of NASDAD's EHE objectives and vision. It will have our updated monthly newsletters, webinar promotions, and cost-saving tools. And by following, you will be able to see other EHE plan submissions. We have a hub where you can see a map of all the EHE jurisdictional plans. So please make sure to visit nasdad.org, Ending HIV Epidemics. We'll be posting these slides there. And additionally, wanted to provide information about available trainings and resources at NASDAD. We have community engagement trainings, cultural humility and responsiveness, and social marketing and social media use. So go ahead and contact Christina Santana if you'd like to learn more about these trainings. We also have this resource, Intentional Exercises for Meaningful Community Engagement through Social Marketing, that you can check out. And we just want to say thank you to everyone that has helped with getting this series off the ground, and a special thank you to KFF for partnering with us on this webinar series. Again, this webinar has been recorded, and we will send all of these materials out. And thank you so much for spending this hour with us as part of this webinar series. So I hope you all have a great day, and thank you so much for joining us.